Bismillahirrahmanirrahim. Today's lecture is about physiological anatomy of the cerebellum. The cerebellum, which stands for little brain, it is also called little brain, is a structure of central nervous system. We know that in central nervous system we have brain and the spinal cord. The cerebellum is an area in the back bottom part of the brain that play an important role in movements and coordination. This is present in the back and bottom area of the brain and responsible for control of the movements and coordination. Although the cerebellum account for approximately 10% of the brain volume. The volume of cerebellum is about 10% of the rest of the brain, but it contains over 50% of total number of neurons in the brain. The number of neurons are 50%. 50% are present in the rest of the brain tissue and 50% neurons are present in the cerebellum. Historically, the cerebellum has been considered a motor structure because cerebellar damage leads to impairment in motor control and posture. When there is damage to the cerebellum, motor activity and posture of a person is become abnormal. Motor commands are not initiated in the cerebellum, rather the cerebellum modifies the motor command of the descending pathway to make movement more adaptive and accurate. Cerebellum is not responsible for the initiation of motor function, but it is for the coordination and accuracy of the motor function. Anatomical function area of the cerebellum. Anatomically, the cerebellum is divided into three lobes by two deep fissures. The cerebellum is divided into two deep fissures into three zones. One is the primary fissure. This is the primary fissure, and it divides the cerebellum into anterior and posterior lobes. And one other fissure, it divides the cerebellum into loconodular lobe. The second fissure divides the cerebellum into another lobe, which is called loconodular lobe. The loconodular lobe is the oldest of all portion of the cerebellum. This is the oldest portion of the cerebellum. It means that during development of the fetus, this area of cerebellum is developed earlier than the rest of the cerebellum. It developed along with and function with the vestibular system in controlling body equilibrium. Longitudinal functional division of the anterior and posterior lobe. The anterior and posterior lobe is then again divided into, in the center of cerebellum, a narrow band called the vermis, separate from the remainder of the cerebellum by a shallow groove. In this area, most cerebellar control function for muscle movement of the axial body, neck, shoulder, proximal limb, arm, and hip are located. To each side of the vermis is a large, laterally protruding cerebellar hemisphere. Cerebellum has two lobes, and to each side, to the right and the left, there is a laterally protruding cerebellar hemisphere. Each of these hemispheres is divided into an intermediate and lateral zone. The intermediate zone of the hemisphere is concerned with the controlling muscle contraction in the distal portion of the upper and lower limbs, especially the hand and finger and feet, and the intermediate zone. This is the intermediate zone, and it is responsible for the control of muscle of distal portion of the upper arm. These are the distal portion of this is the distal portion of the upper arm, and the leg and foot is the distal portion. The intermediate zone of lateral hemisphere is concerned with controlling muscle contraction in the distal portion of the upper and lower limb, especially hand and finger and feet and toes. This lateral zone is responsible for control of movement in the distal portion of the arms and legs. These are the distal portion of the arm and legs, especially the hand and finger and toes and feet. The lateral zone The lateral zone of the hemisphere operate at remote level because this area joins with cerebral cortex in overall planning of sequential motor movement. This area has connection with the cerebral cortex and control overall planning of sequential motor movement. Without this lateral zone, most motor activity of the body lose their appropriate timing and sequencing and therefore become incoordinate. If this zone is damaged or destroyed or due to some diseases it is become non-functioning, the body lose their appropriate timing and sequencing and therefore become incoordinate. Topographical representation of the body in the warmest and intermediate zone. These are the topographical presentation of the body in the warmest and intermediate zone. This is the intermediate zone and this is the warmest. Axial portion of the body lie in the warmest part of the cerebellum, where the limb and facial region lie in the intermediate zone. The axial portion of the body lie in the warmest of the cerebellum, where the limb and the facial region lie in the intermediate zone. The axial portion which lie in the warmest and the limbs and face lie in the intermediate zone. These are the limbs and the face is controlled by the intermediate zone of the cerebellum. These topographical representations receive apparent neuron signal from the respective part of the body as well as from corresponding topographical motor area in the cerebral cortex and brainstem. In turn, they send motor signal back to same respective topographical area of the cerebral motor cortex. The lateral portion of the cerebral hemisphere do not have topographical representation of the body. Here you can see that there is no representation of the body part in the lateral zone or lateral lobe. These area of the cerebellum receive their input signal almost exclusively from the cerebral cortex. This area receive information from the cerebral cortex, especially from the pre-motor area of the frontal cortex and from the somatosensory and other sensory association area of the parietal cortex. This is the primary motor cortex. From here, this zone receives motor information and sensory information from the pre-motor somatosensory area. It is believed that this connectivity with the cerebral cortex allow the lateral portion of the cerebral hemisphere to play important role in planning and coordinating the body rapid sequential movement activity that occur one after another within fraction of second. Thank you. Please subscribe the channel and down the bell icon for in-time notification, and please write down your valuable comment in the comment box for the improvement of the channel.